Our next speaker is Dr. Jeff Small, who's going to be talking about memory training, communication, and technology in Alzheimer's disease. And I'm very much looking forward to this, not having heard an update on Jeff's work for some time.
Thank you, Lynn.
There you go.
Can you hear me? Okay, good. That's better. We should all be using this, right? Thank you for inviting me to this forum, and I'm going to be talking today briefly about some of the research we've been doing on memory training and communication technology. And so how does this relate to Alzheimer's disease? Well, of course, memory loss and impairments affect daily functioning, and communication is how we navigate through our day with people in our environment. And so I'm going to be just touching on a couple areas of research that technology and memory training can have an impact positively, we hope, in communication. So I'm going to start with technology, and then I'll talk about memory training later. Technology, at least the latest advent of technology, began probably 15, 20 years ago. Microsoft developed this device called SenseCam, which is basically a camera that you wear on a lapel, or wear on a lanyard, and it takes photos every few seconds of your daily activities. And then at the end of the day, the user can review those images, they upload it to a computer, and they can scan through and remember significant parts of their day. And the idea is if they review this periodically, they will hopefully be able to remember that and engage in conversation around that with their family members, etc. Moving forward 15 years or so, now we're into the Google age, where you can actually use virtual reality along with Google Maps in this case, and individuals can actually navigate through streets, through countrysides, could be where they grew up, could be vacation destinations and whatnot. And this is a useful technique to get people engaged in reminiscing, as well as in just conversation around different sites that they could encounter. Another technology that you may have heard about is called IN2L. It's never too late. And this is a electronic digital device that is interactive, so it's touchscreen, and the displays can be simply as big as a monitor like this display here, or they can be quite large, as you can see on the left side top there, where a person can actually interact, and in this case she's painting with a stylus. On the bottom right you can see actually it's also can be used for things like Wii, where the person's actually exercising and bicycling through a forested area. So these are all technologies to get people involved in reminiscence or in therapeutic, recreational type activities. What I was interested in my research team was the use of mobile technology such as tablets and smartphones, as well as communication apps, in more everyday functions of communication, not just reminiscence or recreation, but actual getting things done. And so we decided to take on the most difficult environment where getting things done happens, and that is in long-term residential care. And so what we first did is we did an exhaustive review of what we call communication apps, or C apps, in the marketplace. So both Android devices as well as iOS devices. There are hundreds and hundreds of apps. None of them were clearly earmarked for long-term residential care. So we had to just filter through, screen them, and decide based on a parameter of features that we felt were most relevant for interactions between care staff and residents with cognitive impairment, which ones were most viable and potentially useful in this setting. And so we, among the hundreds of apps, we finally narrowed it down to 4 different apps in 2 different categories. The first category was what we call communication support apps. And the 2 tools that we found to be the 2 apps that we found most effective were called Communico Tool and Go Talk Now. And just some of the features they had, in addition to just images that you can use with residents while they're eating or doing an activity to help reinforce what it is that they're supposed to be selecting or choosing from. You can select images, but we also found that this app in particular had a pain scale, which was actually an image of a human body, and the person can actually touch where on the body they are experiencing pain. Now on the right-hand side, there's a scale that goes up and down, and they can lift a lever, if you will, and it increases audibly to show what degree of pain they have. Another thing has to do with feelings. So they can actually create sentences saying, I feel tired, I feel hungry, and using these images to help support their expression. The other type of apps that we found useful, especially in the Lower Mainland or any area where you have a lot of language diversity, are language translation apps. And the most powerful engines that we found were Google Translate, as you might expect, because it had the most languages, and it also seemed to have the most accurate translations. But there's another app called Tabletop Translator, which we also liked. One of the advantages of this app is that if you're using a tablet, you can sit across from the person and they can see the text of what you're speaking in their language, as well as hearing the audio of what you're saying in their language. So you get both the text and the audio in so that they can view it on their side, and then you as the speaker or listener can view the same thing on your side. So these are two categories of apps that we found most relevant and most useful. We also conducted focus groups with the care staff to find out, first, are they using mobile technology in long-term care? And we found that only about half of staff are using mobile technology, in particular smartphones. When we asked them whether they're using any kind of communication app to support daily communication, only about 8% said that they had currently been involved in using communication apps. And about 40% said they had neither used mobile technology nor communication apps in their daily practice. Some of the challenges of using it is that many facilities don't have Wi-Fi that supports smartphone use by staff. So what did we learn from this study? Well, first, there are a number of challenges with using apps with mobile technology. We used iPad minis. They're a fairly small device, but they still require the staff to put them somewhere, right? It's bigger than a smartphone, but not as big as a tablet. Residents, we found, at least this generation of residents in long-term care, are usually not familiar with digital technology. And so they often responded with confusion or uncertainty as to how to even navigate or point and touch the device. Residents with sensory impairments, which is not atypical, hearing and or vision loss made it challenging because the audio on tablets is typically not sufficient to reach their central auditory system sufficiently. For people with visual impairment, it would be nice if the app actually had a photo device that you could capture a photo of something in the environment and it would actually translate it into audio. It would detect it and tell the user what it is that they can't see. And finally, this was quite a prevalent experience for residents, was that their fingers were often not triggering a selection on the iPads themselves. And there's something about the touch, perhaps their skin quality is not sufficient to be recognized by the iPad. So there may need to be some kind of slip cover or finger cover that could be used for that purpose. Some of the features that care staff felt were most important were personalizing the app to meet a particular resident's needs in terms of their food choices, in terms of their hygiene preferences, etc. Secondly, that there be multimodal input, that there be text, that there be images and sound, and if possible, even video. So if you're going to say, we need to go do something in the washroom, you can actually show them a video ahead of time to indicate visually what it is that you're asking them to do. Obviously, a large font and large display would be preferable, especially with people with visual challenges, but the downside of that is care staff cannot be carrying around a large display. So eventually, technology will come to the point where you can actually have a roll-up display, and you can just fold it out when you need it. They also preferred female over male voices, and we're not sure why this is, but it could be just the association between female and caring and nurturing. I'll just skip down. The touchscreen was quite important, but we have the problem with the finger quality not being sensitive enough. So what is the future now for this? Well, we like to do a follow-up study where we take the most effective or appropriate features and bundle them all in a new app. And we did a little preliminary investigation to find out what that would take financially, and it's kind of out of our realm. So what we're going to try to do instead is create what's called a bundle app, which is use existing apps, some of the, for example, the 4 that we found, bundle them together with a superordinate kind of umbrella app that will help seamlessly the person navigate between the different apps, so they can move from language translation to communication support as they go through an activity. All right, moving on to memory training. So the latter was more related to long-term residential care. Memory training research that we've done has been more with families and family members living in their homes. Why am I doing memory training? Well, there's been a lot of research on trying to improve the memory of people with mild cognitive impairment and Alzheimer's disease. The outcomes have not been that promising in terms of improving memory. Typically, memory improves for whatever is trained on, but it often doesn't generalize to their daily functioning. So I was more interested in a memory training technique that actually is relevant to functioning and getting through one's day and communicating with others. And this technique is called spaced retrieval. And I call it user-friendly, and I hope by the end of this talk you'll see that it is, in fact, user-friendly. Basically, it's a mnemonic technique in which you ask the person to follow a script for the memory training that involves repeatedly practicing, not consciously or effortfully, but just practicing remembering a piece of information over successively longer intervals. And I'll demonstrate or I'll illustrate what that is in a minute. Where can you use spaced retrieval memory training, or what can you use it for? You can use it for word-finding problems. So if a person has a difficulty remembering a grandchild's name or objects in their environment, you can use it for prospective memory, remembering what to do in the future. When is a doctor's appointment? When does the garbage need to be taken out? And what I applied it to recently, I was the first one, I think, to apply it to this area of memory, recent memory. What happened recently in that person's life, which is, of course, the most impacted memory domain in Alzheimer's disease. So I'm going to just walk through the training procedures. The first one category we trained in is names. So let's say a person with Alzheimer's wants to be better at recalling the name of their granddaughter, and her name may be Elizabeth. So we're going to write the name of that granddaughter on the back of a photo of that granddaughter. And initially, we'll just have the person try to name the granddaughter without seeing the back of the card to ensure that they, in fact, can't retrieve that granddaughter's name. And then we'll instruct them that we're going to do some training now, and whenever I ask you what you can do to remember your granddaughter's name, all you need to do is turn the card over. So that's all they have to remember is turn the card over. And so we go through this script. We say, where can you look if you want to remember your granddaughter's name? And the response should be, I just can turn over the card. And when they do so, we ask them to read the name of the person. And so we do this iteratively over expanding intervals. So we'll start 0, then 1 minute, and then 2 minutes, 4 minutes, 8 minutes, etc. We'll ask the same question and expect the same response. In between the intervals, we just talk about something unrelated to the granddaughter, something completely different. And by the end, we hope that not only are they spontaneously turning the card over when we ask that prompt question, but in some cases, and people I've worked with, they don't even need to turn the card over anymore. They just say, Elizabeth, which is quite fascinating, because this is like in a 2-hour session that we can get them from not being able to recall someone's name to actually naming it, even without support. What about prospective memory? Well, again, you can use something like a calendar or a notebook, and you can use the prompt, which is, where can you look if you want to remember when something's going to happen? I use this with my father, who had vascular dementia. He was constantly asking, when is my sister going to come and visit? So I said, well, Dad, let's sit down and do some spaced retrieval training. And so we took the calendar off the wall. And I said, see, she's coming on this date. So whenever you want to remember when she's coming, just look at the calendar, set it aside, go through the intervals. The next morning he was in an assisted living facility, and the next morning we're sitting at the dining room and away from his apartment, and all of a sudden he says, oh, I know what you're going to tell me, which was in fact that he should look at the calendar. He was going to ask, when is she coming? So he had, just in that one short session of training, he had remembered that that's where he needed to look for that information. And then, of course, it's useful to assess maintenance over time to see if they are, in fact, retaining that information or retaining the ability to know where to look or where to go. Because this technique is not really enhancing one's memory, it's enhancing how one can access memory. And finally, in the area of recent memory, this is a new territory to navigate through with this technique. We decided to work with people creating an event or an activity in their life, video recording it, and then beginning training immediately after that event. We're not interested in trying to reinvigorate events that happened 5 years ago, because that will be kind of artificial. We want something live and something that they can have real memory traces of. And so we begin training immediately after the event. It could be a birthday party, it could be inviting a grandchild over to play with, could be a hobby of theirs, whatever it is. We shortened it to 15 minutes just because, as you'll see, we had to review parts of the video for the training itself, and you don't want a 2-hour activity if you're going to be doing that. So the prompt here is, what can you do to help you remember your playtime or your reading time with the grandchildren? Response could be, I will look at the video or the movie. And then we will say, so before we watch the video again, can you tell me what you remember from that? So spontaneous recall. And then if they don't remember some of the key details of that event, we'll cue them with, well, what about the stickers? Remember there were stickers? And see if they can tell us what happened with those. And then we will review the video. And again, we do this over intervals, not quite so many, because it takes more time to review the video than it does to turn over a card. And then we assess. So what have we found? Well, we found in this study that recalling names, if you look at the baseline period before training, there's 0 recall. They can't retrieve the name of a person. Go to training, and they're automatically at the top in terms of being able to immediately turn the card over. And this continues for weeks after the training, though sometimes it may dip. In recalling what to do, for example, using a calendar, again, you have baseline, not knowing where to go to find information, to absolutely knowing I can go to my calendar, and this being maintained over time. Now, granted, not everyone reaches this ceiling or 100% level. There's some dips. This is just one individual who showed this pattern. I'm just trying to show here a striking difference between the first 2 categories of word finding and remembering what to do with remembering what's happened recently in that activity. And what we see here is they're very good at remembering that they need to watch the video, right? So that's the top red line. But then when it comes to remembering the core details or the significant parts of the activity, they're only remembering about 1/3 of them through the training. But here you see at maintenance, they actually jump up a little bit to remembering about half. The important contrast here is looking at the bottom where the green with the X's through them. That was another activity we did with the participants. And in this case, invariably across participants, they showed no recall for that control activity. Even the same day that we did the activity, if we asked them 30 minutes later, they wouldn't be able to tell us details. So this may not seem especially impressive in terms of 30% recall, but it is when you see that they're not remembering anything from non-trained activities. So is it easy to do space retrieval training? Well, I think it is, and family members I've talked with seem to think so too. It requires minimal training and minimal preparation time. If you're going to do the activity space retrieval training, you just have a video recorder, a smartphone, and you can video record some activity and begin immediately afterwards. The same prompt is used across training trials. So what can you do to help you remember X? The expanded interval schedule allows for maximum success. So you're starting off with a 1-minute interval If you need to, you can back down to 30 seconds to ensure that they're able to respond successfully. That's key. It's called errorless learning. And the idea is that by doubling, you're actually reinforcing those memory traces through distributed learning rather than through massed learning. Another advantage is the intervals between training episodes can actually be filled with whatever activity you want. Could be reminiscence, could be eating something, whatever you want to do. And then there's a training app that really helps the user, the trainer, navigate through the intervals. So this is an app called Spaced Retrieval Therapy app, developed by Tactus Therapy. And basically it serves as a stopwatch, but it's better than a stopwatch because it alerts you at every time interval so that you can stop whatever you're doing in the interval and go back to your training. And then finally, we are in the process of creating a family-friendly version of spaced retrieval training across all three categories of word finding, prospective memory, as well as recent memory. And we hope to make this available to families to be able to use. We did give this to all of our participants, so if we're doing a future study, you would get this. So thank you.